So when we move from the modelling phase to the implementation, certain new things come into play. One of the really important aspects of this program that's quite unique is its use of technology. Digital technologies to coordinate care, to navigate, to create the tracks that trains can run on, the pathways that people can follow, and to collect data in real time about what is really happening to people's journeys. We do not do that currently. We have chaos, no information, we don't know. We're outcomes blind most of the time. So the digital technology phase which follows on is critical. Without information, you cannot reform systems. Imagine running power plants and electricity grids with no information coming back. In healthcare, we have information about activity, not outcomes. We don't know what's happening. We don't know who's disengaging. We don't know who's receiving care. We don't know which providers are really doing the best job. Information technology and data is critical to that. So the digital technology component of this program is critical to coordination, to data information, to accountability and tracking to see whether we're delivering better outcomes.
One of the things that we have discovered through working with youth mental health services around the country is how variable their models are. There is not one coherent or consistent model of care. So if you're a young person in Western Australia in a rural area, or if you're in an inner city area, or if you are in a regional town, the care that you get depends on the door that you work through and the service and the clinicians there. There is no coherent model of care. You don't find that in treating young people with cancer or with asthma or diabetes. We have a single model of care. We have an understanding about what are the things that young people need and how to get them back to wellness again. So one of the things that we have tried to do is to make sure that we have a model of care that can be used anywhere in the country for any young person, and to try and work with youth services to kind of educate them about how to put that in place. What is it that are there effective ways of assessing young people to make sure that you take into account all the areas that they need addressed in their life, the difficulties that they're presenting with? What are the skills that clinicians need? What are the resources that a service needs to make sure that actually when a young person walks through the door to get care, they get the right care the first time where they live, and that we provide the interventions that are most likely to get them to recover.
The youth model really promotes using technology in services. The key reasons why is that technology can store data and it can interpret data a lot easier than clinicians can with pen and paper questionnaires. But through technology, you can also communicate with other health providers, other health services a lot more easily, which means that young people are supported not just by their primary clinician, by a team of clinicians. And it makes referrals a lot easier. When services need to step up or step down care, it makes it a lot easier to communicate that to other services in the area. For example, if Headspace are referring to a youth mental health, community youth mental health service. But there are also specific reasons why the InnerWell platform in particular supports the youth model. So there are some really key functions that it has that really enable all of the clinical concepts and care concepts that are part of the youth model. So first of all, staging. The platform involves a really in-depth assessment when young people first access their profile, and it provides a lot of in-depth information about all different aspects of a young person's life. So not just their mental health, their physical health, their sleep, what are their relationships like with others, their risk, their eating behaviours, and so you can get a really comprehensive picture of a young person and their full life, which is really key to understanding their clinical stage. But we also know that in order to properly stage a young person, it's not just about what is happening when they first access the service. It's really important to also track what happens over the course of care, because tracking those people who are not progressing or deteriorating during care is really key to being able to identify those young people who are at risk of developing severe mental disorders. And so the platform allows you to do that very easily. Young people can provide information through assessments whenever they would like in between sessions, and the app provides graphs and it provides other kind of graphics that can easily help clinicians and young people to interpret whether their mental health and their kind of overall well-being has improved or deteriorated between sessions. Obviously, then it also promotes multidisciplinary care options because the platform is assessing a range of different outcomes for the young person. It's much easier for the clinician to assess how different aspects of their life are influencing each other. And the platform also allows you to graph certain outcomes at the same time. So you can really easily compare the trajectories of your mental health compared to your sleep, compared to your physical health. And so it's a lot easier for clinicians and young people to understand how different aspects of their life are interrelated. And of course, that again facilitates communication with other multidisciplinary health professionals who might need to be involved, whether that's education specialists or dietitians. And obviously, it's also a lot easier to communicate with other services as well who might need to get involved. Another key aspect is risk assessment. So again, the platform allows young people to, in real time, update when they are having thoughts of wanting to hurt themselves or when their risk is really changing, whether that's due to suicidality, whether that's due to either manic or maybe schizophrenic symptoms. And so services are able to see that and able to respond a lot more quickly. And this is particularly beneficial for those young people who are on wait lists or who haven't accessed care. It really allows services to respond to people who are at risk a lot earlier and to prioritise people who are at high risk into treatments earlier, which again is a key reason for clinical staging, to make sure that those young people who are more severe get the care they need earlier. And then the final really key benefit of the platform, which has kind of been identified already, is this idea of shared decision making. So because young people have access to their own data, they can see their own patterns, they have a much better understanding of their own mental health. And so it's a lot easier for them to make decisions in treatment, because one of the key barriers for young people of being involved in decisions and feeling like they're able to tell their clinician what they want and what their treatment goal should be is that young people really commonly report that they don't understand what is wrong with them, they don't have good insight into their mental health or into their physical health or how different aspects of their life are interrelated. And so giving them data really empowers them to make decisions about their own treatment journey. And so for all of these reasons, in order for the youth model to fully be implemented in services and to really support treatment planning and assessment, we think that it's vital that services adopt technology platforms like InnoWell.
I think digital mental health tools can be really useful, especially when they're used parallel or in conjunction with care, because it gives the young person a chance to say something in a non-confrontational way. So they can go home, reflect on their session or reflect on their week, and then track how they're going. And it lets the clinician know how they're going and brings that back to the conversation when they come into their care the next time, week later, 2 weeks, whatever it might be. So from an administration perspective, having worked in a mental health service before, when we implemented InnoWell and we rolled it out across the service, just the uptake and the energy, the vibe, the feeling that we had from our interactions with young people, with their families, improved drastically. People were happier because they were able to work on something while they were waiting for that appointment with their youth access clinician. They knew that they would have their voice being heard, and if anything did come up, they knew that someone would be reviewing that and actually reviewing it to prepare themselves for that first appointment. So people were extremely happy, and to be honest, we weren't expecting that. I think as a service, we weren't too sure what to expect. So when we did see that it improved not only our phone call time, but it improved the quality of the phone call and the experience of the young person, the experience of the family, our experience as well. All of these things work together to improve a service and improve the what you're providing and that care that you're providing to a young person and to their family. And I think with Innerwell, it really does help with that no wrong door policy. So it isn't a barrier to care. You don't have to wait 2 weeks or 4 weeks for your first appointment before you tell your story. You can start as soon as you call up, as soon as you're sent that invite link. And I think, yeah, just from a service perspective as well, it improved our morale because we felt we were helping our clients and our young people and their families sooner, and we were able to help each other sooner as well.